According to the annual health sector performance report, malaria cases increased from 13 million in 2011-2012 to 15 million in 2012-2013. The Minister of Health attributes this to a number of reasons.
Improved health facilities, because when the local people know that there are drugs, they will come. Possibly because of increased detection, because we have been able to improve on diagnosis, increase in population, changes of weather.
Leaving mosquitoes to breed with abandon.
It's also possible that the intervention that we are having for malaria are not yet brought to scale. I'll give you an example, like a very highly effective intervention. We called it indoor residual spraying, but this was only in 10 districts.
Malaria is still the leading killer for all age groups, followed by pneumonia and anemia in children under 5. The challenges in blood transfusion also contributed a lot to malaria deaths. Another area that has not registered significant progress is reproductive health. This at a time when the country needs to meet the UN Millennium Development Goals of improving maternal and child health by 2015. Living through this year's report, while TB treatment success rate has improved from 71% in 2011-2012 to 79% in 2012-2013, the detection rate has gone down to 55% from 57%. However, more patients who have co-infections of TB and HIV have been enrolled on ARVs. Overall, the sector has done well with HIV. According to Dr. Asuman Lukwago, the Permanent Secretary and Minister of Health, amongst the greatest achievement has been the public-private partnership.
And we think this one can inspire us into real performance and therefore help to solve some of the challenges within the sector.
The ministry also boasts of responding fast in handling emerging health threats, especially outbreaks like Ebola and Marburg. The civil society organizations interested in health are, however, concerned about absenteeism of health workers.
A World Bank study, Physical Space for Health in Uganda, established that health workers' absenteeism was 37%, costing government 26 billion per year. We conducted a follow-up study that put absenteeism at 48%.
We are going to reactivate the interest and morale of the health workers and also have stricter measures of monitoring to ensure that people who are paid by the taxpayer are performing the duties that they are expected to perform.
But there are other non-health workers. The ministry boasts of having created the village health teams. Now their numbers are in decline.
It's an area of interest to us. We've noted a decrease from 78% to 55% as far as training of VHTs are concerned.
We have agreed in the ministry that we need to look at the VHT policy, look at the VHT terms, and then maybe design better packages. But the cardinal principle of a village health team member is that it must be voluntary.
Unfortunately for the ministry, the money given by government does not go far enough.
It was discovered that for us to have very good health care, where you find doctors are around, well paid, drugs are available, infrastructure is okay, we need to spend about $40 per capita. This would come to about 100,000 Uganda shillings per capita. This would mean that if we were to have that kind of good health system, we need to be allocating about 3.4 trillion.
The ministry is now considering having more health reforms. For now, though, the health sector strategic and investment plan targets have to accomplish double what was not realized this past year. Florence Nalimba, NTV.